how to make reasonable adjustments for people with a learning disability and autistic people in emergency departments.
Hi, my name's Hilary Gardner and I'm the Strategic Liaison Nurse for Learning Disabilities in Hertfordshire. So this video is just a short video about the impact when somebody comes to an A&E or emergency department who has a learning disability, the impact it can have of just how you interact with that person at that time. Going to A&E is an absolutely scary experience for absolutely everyone. So now imagine that you also are aware you need to be somewhere because you're not well, but you have no cognitive ability to really, truly comprehend it the same way as everyone else what's going to happen, why you're there, and that everyone is there to help you. So you've got that natural fear, you're in fight or flight mode and you're scared. So everything you do could make that difference between that person receiving healthcare and not receiving healthcare. So I'm here with two colleagues who are experts by experience, and they will introduce themselves and they're going to talk through with you those tiny weeny steps you can take that make all the difference.
Meet Gavin and Sam as they share their experiences and give advice in their roles as experts through experience.
Hello, I'm Gavin Howcroft. I'm an expert by experience advisor for the Health Liaison team at Hertfordshire County Council.
And my name is Sam Proust. I'm an expert by experience advisor for the Adult Disability Service at Hertfordshire County Council. So being experts by experience, we use our experiences of learning disability and autism to go and try and help colleagues to improve the way they support people. So what we're doing today is we're talking about emergency medicine.
Yeah.
Going into A&E, so you're not well. We're going to use the TEACH acronym.
Yep.
And the 5 letters there to kind of talk about our own experiences and things that could make a difference. So for T,
Time, yeah.
yeah, so time is probably one of the most important aspects, isn't it? Because when you're going into A&E, that's a really scary time. It's outside of your normal routine.
Yeah.
And that can be really disruptive. So Hilary talked about flight or fight. Just to go somewhere that's different to like a normal routine, what you're expected to do, can be really scary. So I don't know, is there anything you wanted to...
Yes, I find time crucial when I'm anxiety. So I get very bad anxiety going into hospital and I can get very worked up. And what happens when I get worked up is I can sometimes shout and I don't realise I'm shouting. So I might go in there and I might be like, hello, I'm Gavin Howcroft, I'm here today, do you know how long I'm going to be here for? And they say, well, can you please stop shouting at me? And I'm like, I'm not shouting at you. And the longer I have to wait when I'm like that, it can make it a lot more harder for me because I don't realise that that's what I'm doing. So I just think I'm talking to them like I'm talking to you now. So really, one of the reasonable adjustments I need when I go into hospital is for me to be seen quite quickly, so then it can bring that anxiety down a bit and they can talk over with me how they're going to help me through the appointment and what's going to work for me.
So by doing that, all of that triaging quite as soon as possible, they can work out what reasonable adjustments you might need, but actually the most important bit there is to try and make you feel safe.
Yeah.
So by feeling safe, you're likely to stay, aren't you, and get that treatment that you need to then get better.
Yeah, precisely, yeah. E is for environment. It's amazing how environment can make such a difference for someone with a learning disability or an autistic person.
When you think about all of the things that go on in A&E, you've got loads of different sensory things. So you've got lots of bright lights, you've got different smells, you've got lots of noise, you've got lots of traffic of people. That can be really hard to process. And I don't think a lot of people that don't have learning disabilities or aren't autistic don't necessarily think about those things. And for me, that makes a massive difference. I can get quite overwhelmed, and if I get overwhelmed, I can close up, and I might not open up and be able to tell you more things about why I'm there. So I've had it before where it's been really busy and I was kind of losing focus, and then from one stage of something I went off to go and have an X-ray. And when I had the X-ray, I was in a quieter waiting room, and I just said to them, I was like, can I just stay here for a little bit? It's quieter and I feel a little bit more comfortable and more relaxed. And they were happy to have that because it worked well. Other people, you might have it where they go into like a bay, so they come in triaged and into a bay because they're going to have to go there anyway, but actually it just makes people more comfortable in that space.
Yes, for me, I need to wait outside. That's what helps me when I go into hospital. So like I've already talked about how I get anxiety and how that when I get anxiety I can start shouting. If that anxiety continues, I can start doing other things like getting restless, and that can make it more harder for me to access healthcare. So what they've done for me now as a reasonable adjustment is they let me sit outside in the grounds on a bench, and just being outside away from that manic environment and things, the noise and everything, it just helps me overcome that, especially when I get anxious. So now whenever I go for a hospital appointment, I'm able to sit in the grounds on the bench, and they will just come out and get to me and bring me in when it's time, and it just brings that whole other level of feeling much more relaxed when going into hospital if they make those reasonable adjustments.
So getting you at the best in the kind of worst situation, you're going in an emergency, but being able to give you the best aspect of where you are.
Yeah.
A is for attitude, and this is about making sure that you've got a can-do attitude to make sure that people with learning disabilities and autistic people get the same health outcomes as people without. We know that this is really scary for some people, and some people might not accept the help that they need. And it's about thinking about best interests and what is the right way to support someone, thinking about the reasonable adjustments so that they can have the best input into this. We know that the best outcome is to get the health support that they need, and if they don't, it can be quite there's no point.
Challenging. Yeah.
So I just wondered if you've got an example for us.
Yes, I have. Yes, I used to have really bad needle phobia when I was younger, and I would just say no to needles all the time. Didn't matter what it was for, I would just say no. And I remember I had two quite important hospital ones, and I just went there because I just thought, you wouldn't need a needle. And then as soon as they said, yes, you'd have to have a blood test, I was like, no, I'm not going to do it. I'm not going to do it. And they said, okay, no worries, but you won't be able to have the procedure. I said, yep, okay, no worries at all. I'm not going to do it. And then a nurse sat down with me and explained to me that actually it's really important that I have blood tests, because if I ever wanted to look up something on Google, I could just type that in, but they, unfortunately, they can't just type in Google what's going on with Gavin's body. So that, that with that doing that, they can look up things like, what if I've got any diseases or anything like that, and it can, they can look in on what's going on inside my body with a blood test, which then got me realising how important it was. And I said, well, okay, I understand that now, but I didn't before, and didn't. Why was it no one's ever explained this to me before? Did they not care? Did they want me to die? And she said, well, no, unfortunately, Gavin, they were just killing you with kindness. They weren't explaining to you, like I have, why it's important you have a needle. And with that, we talked about reasonable adjustments, which could help me overcome that anxiety to help them give me a needle, which really helped.
So C is for communication, and you really need to think about this non-verbal communication as well, and that's from yourselves and the confidence that you give off. And we all get told to speak to a patient first, and that's really important, but actually it's about the impression that you're giving off. And sometimes there's this awkwardness that you might feel, and that's okay to feel awkward, but you need to make sure that you address that. People will pick up on that, and it's about making sure that you're confident in the way that you're explaining things, the way that you make people feel safe. And by feeling safe, that can make such a big difference. And I remember you telling me an example before about this, Gavin.
Yes, so I even though I come across able, I can also get very, I can just say yes, yes, yes to things when I get anxious. So there was one time when I was in hospital and they told me that I was going to have to self-inject myself. This immediately made me feel worried, and I said, I don't think I can do that. I don't want to do that. And they said, well, you have to do it or you have to stay in hospital. This then made my anxiety worse, which meant I just said, okay, yes, I can do it. And the whole time they went through it with me, with these injections, I just said, yes, 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 all the time. So it made them think that I understood. I actually went away and I had no idea what to do. And I went home and my wife said to me, she said, Gavin, what are the needles for? And I said, oh, they're not important. I'm seeing the doctor and I'm having a scan done in a few days. And, I'll get, I don't need to do them. My wife said to me, well, they must be important, Gavin. I think you need to ring a doctor. And they were important because they were actually emergency blood thinners for a DVT. Now, when the nurse came to me the next day, she explained to me that these needles were really important because they could stop this from killing me, and explained it to me. But I hadn't taken it in that day because I was worried. I was told that I might have to stay in hospital if I didn't take them, and my anxiety just went over where I just said yes, yes, yes the whole time.
So more than just asking the questions, it's about asking questions in different ways that could be the same, to get the same answer, but to make sure that they check your understanding.
Yeah.
And it's really great that you had Naomi there to support you, because
Yes.
actually that's really serious.
So we're now on to help, H for help. As you heard in my last story, Naomi really helped me by getting me to ring the doctor to understand more about those needles. Sometimes though, it's harder because Naomi comes across a lot more unable than me, which means when I need Naomi's help and I've asked if she can come in, they've said no because they don't want two of us in there. This is important though because Naomi can really help me by picking up where I get anxious. She could say, no, Gavin's not understanding this because he's anxious, or Gavin is finding this, Gavin, it's fine, what he's explaining to you this. That's where she can really help me with those things.
That's really, really important. I think one of the things that when you go to A&E, you get bombarded with so many questions. What's your name, what's your address, phone number, next of kin. All of that is a swamp of information. And when I mean a swamp, I mean like really overwhelming. And you've got to think about different ways that you can get that information. Is someone going to A&E, have they got someone there that may be able to give that information? Have they got a health passport that will tell you all of that information? And really importantly, that can tell you some of the reasonable adjustments that they may need.
Yes, so help is actually like a triangle. You got the person, and then you got the doctor who's trying to help you, but then you got the other people who are trying to help, who could help the person.
I've had it before where I've been to A&E and it's been at night, and in my brain almost like it's been embedded, don't ring people at night because it's a real worry. And I could have probably had my dad's help and it would have been really beneficial. He may have been able to share some information with the doctors to make sure that I got the right help. I did get the right help, but it could have been a lot smoother and better for me if I'd called him. So sometimes it's just about explaining that it's okay to call for help.
A summary from Gavin and Sam.
So that was teach. time, environment, attitude, communication and help.
So we hope that the reasonable adjustments that you've learned through Teach help you to support the people that you see in your work. You know, it can make a real difference in someone's life or death, and that's scary, but actually keep these really simple things and that can make such a big difference. You'll see a load of links as well attached on this video to other videos that we've made in the past. Reasonable adjustments for all the people with learning disability.